Obstetric care, pregnancy and delivery services, is one of the most sensitive clinical services in any hospital. Because in obstetric care, two lives are involved: the mother, the baby. If during pregnancy care, high-risk pregnancy is not identified, labor monitoring is not done properly, neonatal support is not available, then maternal and neonatal complications can increase significantly. That is why NABH introduced the COP-10 standard, which ensures that obstetric care in hospitals is safe, systematic and evidence-based. What you will learn in this video. In this video we will understand what NABH COP-10 standard says, what assesses check in obstetric services, common mistakes hospitals make, and how hospitals can become COP-10 compliant. Let's begin. What is NABH COP-10 standard? The COP-10 standard states, the organization provides safe obstetric care. This means hospitals must ensure that care from pregnancy, labor and delivery, post-delivery care is provided according to standard protocols and clinical guidelines. Objective elements of COP-10. COP-10 includes several important elements: safe obstetric care protocols, high-risk pregnancy identification, competent obstetric staff, antenatal services, birth companion support, respectful maternity care, maternal nutrition assessment, perinatal and postnatal monitoring, neonatal care facilities, ART practices compliance. During NABH assessment, these elements are verified through obstetric policies, antenatal records, staff interviews. Safe obstetric care protocols. Hospitals must provide obstetric services according to evidence-based clinical guidelines, standard treatment protocols. This ensures consistent and safe maternity care. Scope of obstetric services. Hospitals must clearly define their scope of obstetric services, such as whether they manage high-risk pregnancies or provide only normal obstetric care. This helps ensure patients receive appropriate level of care. High-risk obstetric cases. Hospitals must define criteria for high-risk pregnancy. Examples include severe hypertension, gestational diabetes, multiple pregnancy, previous cesarean section. Identification of these conditions helps prevent maternal complications. Obstetric emergency training. Obstetric staff must be trained in obstetric emergencies, labor complications. Proper training ensures rapid response during emergencies. Identification of high-risk pregnancy. High-risk pregnancies should be identified early during antenatal checkups. Early detection allows doctors to monitor patients closely, plan appropriate management. Management of high-risk pregnancy. If the hospital manages high-risk cases, it must ensure competent obstetricians, appropriate facilities. If the hospital cannot manage such cases, patients must be referred to higher centers. Competency of staff. Staff managing obstetric patients must be qualified, trained, experienced. This ensures safe pregnancy and delivery care. Antenatal services. Hospitals must provide antenatal care services. Antenatal care includes medical assessment, immunization, nutrition counseling, regular antenatal checkups. Antenatal card. Each pregnant woman should have an antenatal card. This card should contain medical history, obstetric history, examination findings. Proper documentation helps track pregnancy progress. Birth companion. COP-10 also encourages the presence of a birth companion during labor. A birth companion may be husband, mother, family member. This provides emotional support to the mother. Respectful maternity care. Hospital staff must ensure respectful behavior toward pregnant women. Protection of patient privacy. Labor rooms should maintain privacy using curtains, partitions. Education of pregnant women. Doctors and healthcare teams should educate pregnant women about danger signs during pregnancy, important care instructions. Patient education improves maternal safety. Maternal nutrition assessment. Obstetric assessment must include maternal nutrition evaluation. Ideally, this assessment should be performed by a qualified dietitian. Proper nutrition helps improve maternal and neonatal outcomes. Perinatal monitoring. During labor, monitoring should include fetal heart rate monitoring, labor progression monitoring. This helps detect complications early. Postnatal monitoring. After delivery, monitoring should include mother's clinical condition, early detection of postpartum hemorrhage. Proper monitoring helps prevent maternal mortality. Neonatal care facilities. Hospitals providing obstetric services must also ensure neonatal care support. Depending on hospital scope, facilities may include NICU Level 1, NICU Level 2, NICU Level 3. NICU units should have pediatricians or neonatologists, trained nurses, assisted reproductive technology, ART. If the hospital provides ART services, it must follow ART Act guidelines, national regulatory requirements. ART services must include ART laboratory, trained ART team, counseling services. Proper consent and patient screening are mandatory for ART procedures. Common NABH non-conformities in COP-10. Common observations during NABH assessments include high-risk pregnancy criteria not defined, incomplete antenatal records, labor monitoring documentation missing, maternal counseling not documented, inadequate neonatal support. Hospitals should address these issues to avoid assessment non-conformities. How hospitals can become COP-10 compliant. Hospitals can comply with COP-10 by developing obstetric SOP, implementing high-risk pregnancy identification systems, strengthening antenatal documentation, implementing respectful maternity care practices, ensuring neonatal support. These steps help hospitals effectively comply with NABH COP-10 standards. In the next video of this NABH training series, we will discuss COP-11, organization provides safe pediatric services. If you want to learn NABH standards step by step, then like this video, subscribe to the channel, turn on the notification bell, so you never miss upcoming NABH training videos. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.